For the next oral presentation is the effect of Cisadua therapy on glycemic level in primary knee osteoarthritis with type 2 diabetes mellitus, presented by Yanonat Tawanseri Watana from Faculty of Medicine, Naresuan University.
Good morning, ladies and gentlemen, and members of the panel. My name is Yanonat Tawanseri Watana from Faculty of Medicine, Naresuan University. Today, I am going to present my research project on the topic of the effect of Cisadua therapy on glycemic level in primary osteoarthritis knee with type 2 diabetes mellitus. At Naresuan University Hospital, approximately 4,000 patients presented with primary osteoarthritis knee over 6 months. Among these patients, 1/5 of them also had type 2 diabetes mellitus as a comorbidities. There are several treatment modalities for osteoarthritis, one of which is use of Cisadua such as glucosamine and diazoxide, but the drug effect on glycemic control are still debated. Glucosamine exerts its therapeutic action in osteoarthritis by reducing inflammation. Regarding glycemic regulation, preclinical studies demonstrated that glucosamine can induce insulin resistance, yet clinical studies show no significant change in blood sugar. Despite these findings, clinical practice guidelines still recommend that considering blood glucose monitoring when prescribing glucosamine to diabetic patients. In contrast to glucosamine, diazoxide acts to reducing inflammation. Furthermore, both preclinical and clinical studies demonstrated that diazoxide can reduce insulin resistance and significantly lower blood glucose level. At our hospital, both drugs are prescribed to patients with primary osteoarthritis knee and type 2 DM. This inconclusive evidence leads to clinical uncertainties. If this drug affects glycemic control, patients may require intensive blood glucose monitoring to prevent adverse effects related to diabetes. This leads to the third question that, does Cisadua therapy affect glycemic level in primary osteoarthritis knee and type 2 DM? Therefore, our research objectives are to compare mean difference of fasting blood sugar over 1 year between the first one is glucosamine group and non-Cisadua group, and the second one is diazoxide group and non-Cisadua group. For our research, this is therapeutic research. The study sample included patients with primary osteoarthritis knee and type 2 DM. We conducted a retrospective observational cohort study at Orthopedic Department of Naresuan University Hospital using patients' data from Hospital Information System. To conduct the study, determinant X is use of Cisadua therapy, and endpoint Y is fasting blood sugar that we will collect at baseline every 3 months for 1 year. Finally, we adjusted confounding factors identified from previous studies such as gender, age, BMI at the beginning of study. For study flow diagram, the study started by 706 patients who presented with primary osteoarthritis knee and type 2 DM. After we applied exclusion criteria, it remained 364 patients. Then we divided into 3 groups, included non-Cisadua group, glucosamine group, and diazoxide group. Finally, we collected fasting blood sugar at baseline every 3 months for 1 year. For statistical analysis, we used mean and SD to characterize the baseline characteristic. To accept difference among this group, we apply ANOVA and exact test. Crucially, to compare mean difference of fasting blood sugar across different time periods, we applied multivariable, multi-level Gaussian regression. The study results showed that the study sample was predominantly female, with an average age between 65 and 67 years old. Overall, there were no statistically significant difference among this group, except the group that used of lipid-lowering agent. The spaghetti plots visualize the overall individual fasting blood sugar. The plot revealed that patients in non-Cisadua group predominantly clustered throughout the study period, while glucosamine group and diazoxide group showed wider distribution of individual lines. According to the repeated measure design and potential time-dependent effect, multi-level Gaussian regressions was applied. We also adjusted all confounding factors. The study results showed that the patient who received glucosamine will increase fasting blood sugar 1.75 over time, while the diazoxide was shown an increase 0.39 per month. assuming that the representative mean of fasting blood sugar in each group is linear. Predictive margins showed that the slope of glucosamine group is steeper, which demonstrated a trend to increase fasting blood sugar over time, while the aspirin group and non-cisadua group displayed minimal slope indicating little change. Again, these trends were not statistically significant. So, we would like to discuss in 3 points. The first topic focuses on the effect of glucosamine on glycemic control. The study results showed that glucosamine can increase fasting blood sugar over time, but the change was not significant. The study result is consistent with previous clinical trials as the hexosamine pathway does not play a crucial role in human model. For diasterein did not significantly decrease fasting blood sugar because the progression of diabetes mellitus affect diasterein efficacy. The drug effect on insulin resistance is time limited. The last topic that we discussed is about confounding factors. Confounding factors were recorded only at baseline and assumed to be constant throughout the study period. We did not consider time-varying effect of confounding factors. Due to an unclear relationship between confounding factors, we chose to adjust it for all of them. The strengths of our research are that it's based on clinical practice in outdoor setting and compare all of cisadua therapy that have an effect on glycemic control, but the limitations are missing data and observed confounding factors. In conclusion, this study suggests that patients with primary osteoarthritis knee and type 2DM can safely receive cisadua therapy over 1 year without additionally requiring intensive blood glucose monitoring. Lastly, our deepest thanks to our supporters shown here, and these are selected representatives used in this presentation. Thank you for your attention. I am now open to any question and comment.
Let's give a round of applause, such a well-articulated presentation. Here's the judges.
Thanks for the presentation. Do you have any information on the adherence to the cisadua treatment?
You mean that when the physician prescribes
The
cisadua, right?
adherence to the medicine that you study, the glucosamine and diasterein.
You mean adherence to use to affect glycemic control?
The adherence of the patients, do you have that information?
For the adherence for the patients to take
Yes,
cisadua,
yes.
okay. For at our setting, for adherence of patient who takes cisadua is patient with primary osteoarthritis knee who also have type 2DM, and you mean that right? You mean the patient who takes this drug, right? May you change the phrase, please?
Okay, let me explain more.
Okay.
The adherence mean that did the patient take glucosamine 100% or maybe not?
Okay.
Okay, so that might be another confounder.
Okay, for the patient that we used in this presentation or selected to our studies, they 100% to take glucosamine and 100% to take diasterein without any other cisadua therapy that affect to these drugs.
How do you know that a patient took the drug 100%? Maybe forget. Do you have any counting on the adherence?
For our research, we do a retrospective observational cohort studies, and then we review the treatment of each patient, and we know that okay, these patients are surely take this medication 100% over 5 years.
How do you be sure?
Yes, I am surely because I review all the treatment.
Do you have any collection of the data on drug adherence? Like when you review medical record, do you have the standard counting on the adherence of the drug? Every time the pharmacist check the pill or something like that. If you do not have that, then you can say that we do not have the information.
You mean information to prescribe this drug, right?
Not the prescribe, but the taking by the patient.
Okay, I didn't know. We didn't know. Surely didn't know that patient may 100% to take these drugs, but we assume that okay, they will have a good compliance. Okay.
Though that's based on the assumption, so you
Okay.
do not have the exact information on the adherence, you can say that. And that may be one of the limitation of the study.
Okay. Thank you for your comment.
Thank you. Okay.
Since
Oh.
this is retrospective data, so do you have data that show how many patients that changed the diabetic drugs during the study?
You mean change the diabetes when the prescribed Cisador, right? We assume that the confounding factors will be constant as baseline and assume that they continue to take the same medication over the study period.
So every
And-
patient in the study have to stable
Yes.
use of the anti-diabetic drugs?
Yes, for
Is that-
for of
is
the
that,
patients. For
so
the
this is
patients.
a retrospective data, right?
Yes, this is a retrospective data.
Why the doctor didn't change the anti-diabetic drugs? Since I saw that in your data, they have so many patients that have high blood glucose level, and next time they decrease.
You mean that the physician may be changed the medication, right? When I review that, I chose the patients. When I review the medication, and I saw that patients will remain the constant of the medication of treatment, and is to be constant because our exclusion criteria is patient must be receive the instance of the medication.
So another question, if I may have a time.
Okay.
So in terms of glycemic control, recently we used hemoglobin A1C instead of fasting blood sugar. As you can see that the fasting is very variable. So why not we use the hemoglobin A1C instead of blood sugar?
For our research, we also analyze both of our fasting blood sugar and HbA1c, and we know that fasting blood sugar is the label data, but when we analyze HbA1c, they are unsaturated data, but the result is remain the same. So we chose fasting blood sugar due to our power of studies and the same of the result of them. So I think it's comparable.
If no questions, thank you.